I was referred to CMHT in Shaftesbury. I think when people first consider trying to get a referral, there will be some hesitation because it's a huge step to take, and to trust someone else with what's in your head is very difficult, even now for me. So at the beginning, to have someone who can understand through years of experience, and even the younger members of the team, the ladies that answer the phone, they are all very compassionate. Dr. Van Rensburg, psychiatrist, gave me an appointment fairly promptly, and really I've never looked back. When I first met Paul, I believe I was in with Dr. Van Rensburg. He can make you laugh sometimes when you're feeling, that you can't really say anymore. Paul has knowledge of most of the things in my history, but to explain any of that to anybody else would be enormously difficult. In fact, I don't think I could do it. And he knows that working with a psychologist is extremely difficult. And talking to him afterwards, he's understanding. I've found that this particular team is better than anybody that I've had dealings with in the past. In the old building, the Westminster Memorial Hospital, it is basically an old building. And so the rooms are quite compact and bijou. On a couple of occasions, I've met up with one of the team in an inner room, which has got no windows. And for me, that is a no-go, because I find I can't breathe. It puts me into panic mode. I've never been back in the room. They've always tried to accommodate my problem with closed spaces, and I've always ended up in a room in the hospital, but of late it's been in this other building, this other house outside but adjacent to the Memorial Hospital. Yes, there's always a lot of discussion. Dr. Van Rensburg, being my psychiatrist, she deals with the medication side of things. I've got to know what works. I've got a huge amount of allergies and reactions to antidepressant drugs. I'm very wary about changing anything. And she and I discuss it because she understands that I'm afraid, basically, because the last time it was tried was when I was in East Sussex, and I ended up in a psychiatric unit for 18 months. And believe me, that is not an experience I want to go through again. Moving on to Paul, he is my prop, if you like. He is in between the psychology and the psychiatrist. So I can say a lot of things to Paul and ask him questions about both sides of it. And he is so experienced, he's more often than not got the answer, or he will get the answer for me. So there's a lot of trust in our relationship. And moving on to Jo, the psychologist, she has an empathy that is very encouraging to open up a bit. And it all works for me. It gels perfectly because it's a three-pronged attack, if you like, to support me. And it's outstanding. Very much so. Everybody that you speak to cares. Even outside the mental health unit, the staff in there are just amazing. And the lady that saw me, I got a hug from on the way out, They are just the most friendly and caring people I know. definitely. If there's any time that I don't feel safe, I either phone them, and out of hours time I would either present at A&E or I would talk to someone like the Samaritans. They've given me several numbers for out of hours calls for support. So yeah, definitely. I think one of the main problems is being in North Dorset. If it's a weekend and you need crisis assistance, you have to go to either Salisbury or Yeovil or even Dorchester. And that's a huge long way to go. And again, you start having to talk to people that don't know anything about you, basically. But if you're in crisis to that extent, which I have been once or twice, I've had to go to Yeovil. That makes it a bit difficult. But generally, you can't fault the care. Everything is done well. Everything just gels with the team. They are a team. I can honestly say that if I hadn't been put in the care of the CMHT in Shaftesbury, I wouldn't be here. They are so compassionate, and there's no way of expressing gratitude enough to them.